Brings us now to Ask the Expert. January is Cervical Health Awareness Month.
The goal here is to encourage women across the country to get screened for cervical cancer and also receive the HPV vaccine if they're eligible. Dr. Brian Baird joining us live this afternoon. What is new in the screening for cervical cancer?
Well, in May we talked about the fact that you need to do co-testing with HPV and a pap smear. Now, as we know, human papillomavirus is the main cause of cervical cancer, and they're now recommending a human papillomavirus primary test to screen and remove the pap smear from the picture.
Okay.
And this is revolutionary.
Do you agree with that, the pap smear can be removed from the picture?
Well, it certainly simplifies things, and really what's changed is that this co-testing came about approximately 5 years ago, and everyone has finally adopted this. And then 13 of our governing bodies, including the American College of OBGYN and the American Cancer Society, are now saying that we should strongly consider primary HPV swab as the only testing.
And now let's get into the vaccine. You strongly recommend all women within a certain age get that HPV vaccine?
I recommend all women and young men. It started with young women ages 9 to 26, and then it was extended to young men ages 9 to 26
okay. I didn't
as
know
well.
that.
Yeah, and you talk to a lot of the young men out there, and they're like, "What are you talking about?" But we're trying to mass immunize people to create good cervical health.
Is there a risk you see in lowering the frequency of pap smears? Because one of the great things about it, as you were telling us in the break, is it gets people in their doctor's office.
Right. Well, this is the thing. This virus, this new test, has a predictive value that's superior to the pap for determining if you have a low cervical cancer risk. And you can do this on a 3-year basis. We just have evolved to telling people to not come in, you don't need to have this test every year. And this test has such a good predictive value, but the controversy is that to just stop doing what we've been doing without vast numbers determining cancer risk, I think we need some time to adapt to that.
Right. And the last thing you want to do is not go to a doctor at all.
Absolutely.
You need to get checkups, whether it's a pap smear or just a regular checkup. You need to see your doctor.
No question, because talking to your doctor is going to help you to determine what testing you need to do at what intervals and help lower your cervical cancer risk.
All right, Dr. Baird, thanks for coming in this Friday afternoon. Have a question for him or any of our experts? Here's how you do it. Ask the expert at TMJ4.com or leaving a voicemail at that number right there on your screen.